Assessing ears. Purpose: to provide information about the client's ability to interact with the environment, to evaluate the client's risk for hearing loss. Assessment: level of consciousness of the client, availability and functionality of equipment needed, changes in hearing, presence of ear drainage, presence of ear pain, presence of ringing, roaring, or cracking in the ear, feeling of spinning on that the room is spinning, presence of infections, kind of treatments for ear problem, presence of hearing loss history in the family, kind of activities of daily living, if wearing a hearing aid. Planning: preparing the client, position the client comfortability in a sitting position, and explain the test to the client in details.
We have the watch with
External:
set in hand, then tuning fork,
inspect the auricular
otoscope,
tragus or lugul for the
and
size,
gloves.
shape, and position. Inspect for lesions, discoloration, or discharge. And palpate the auricle and mastoid process. Holding the instrument with your dominant hand, turn the light on the otoscope to on. Use the thumb and fingers of your opposite hand to grasp the client auricle firmly but gently. Use the otoscope. Pull up and back. Hold the handle of the instrument between your thumb and fingers and hold the instrument up and down. Position the hand holding the otoscope against the client's hand or face. Insert the speculum gently down and forward the ear canal to 0.5 inch and avoid launching either side of the inner portion of the canal. Inspect the color and consistency of the ear canal walls and character of the nodules, and inspect the tympanic membrane. Hearing and equilibrium test. Ask the client to gently occlude the ear not being tested and rub the tragus with a finger in a circular motion. Test the better ear and then the poorer one, with your head 2 feet behind the client so that client cannot see your lips move.
Popcorn, football.
And ask the client to repeat back to you. Strike a tuning fork with the back of your hand and place it the center of the client's head or forehead. Centering is the most important. Ask whether the client hears the sound better in one ear or the same in both ears. Strike a tuning fork and place the base of the fork on the client mastoid process, then ask the client to tell you when the sound is no longer heard. Then move the prongs of the tuning fork to the front of the external auditory canal and then ask the client to tell you if heard sound is audible after the fork is removed. Ask the client to stand with feet together, arms at chest, and eyes open, then with the eyes closed.